Hi everyone, in this video we'll demonstrate Nara. Nara is Narrative for Your Health. It's an application designed to be your health command center. It allows you to manage your health details as well as the health data of your dependents, whether it be your mom and dad or any other individual. Right here on the homepage of Nara, you would see different functionalities. A health timeline displaying where you stand in terms of your health indicators, a chatbot to ask any questions based upon your data or other public information, basically a to-do list or a care plan to monitor your focus areas, appointments that you may have with physicians and hospitals, a place to track your healthcare data that can come in the form of PDFs and other unstructured documents, or in the form of wearables such as Apple Health Kit or Whoop, Aura, etc. Find Care is a feature where you can identify physicians and hospitals. Calories, you can track the calories that you have consumed on a day and how much you have spent based upon your wearable information. And there's also a space to ask questions about what is covered in your insurance and also to add family members or other dependents. So in my page right here, I've added my parents, my mom and dad, and I can see their profile added here. I can also view the health of my mom and dad by switching the profile from myself to their profiles. So if I go to timeline view, I get a view of where I stand in terms of my health. So based upon the annual checkup data that I have provided to this application, I can also ask the clinics to mail to a secure link using this particular add data feature within my data. Once the data is synced, I can see where I stand. So right now I have some work to do on bettering my cholesterol levels and also to better my sleep. There is information related to shorter nights on some of the days. In addition to that, I get a report listing where I need to focus upon more cardiovascular activity, daily signals in terms of my heart rate, sleep, steps, etc., and where I stand in terms of how much I have eaten, how much I have burned, how much proteins I've consumed, and also my lab results, where I stand in terms of cholesterol or any other metric right here. In addition to this, I can switch to my parents' profile and see where they stand as well. So as an Indian living in the US, it is easy for me to monitor the health data of my parents. I can also book visits using this application to any hospitals on their behalf across the globe. So I can book a appointment for them to have a appointment with a physician perhaps tomorrow in India. I can do that particular activity as well, which we'll go into, which is in the Care Navigator. So this health timeline provides a detailed analysis of where you stand in terms of your health and your dependents, and the care plan provides you what you have to focus upon in terms of your health data. My father has to focus upon his blood sugar details, and also other than blood sugar, there are a few other indicators that are somewhat alarming in terms of the health data uploaded. If I switch to my profile, I actively use this particular application for calorie tracking. So it allows me to track how much I have burned, how much I have eaten, how much protein I have consumed, which is very important for me. I can add all the food that I have consumed throughout the days by just clicking on this button, taking a snapshot of the food or explaining it. I can even log previous meals and then select any item from that particular list and then put it in this particular application. I can even scan a nutrient label or even the barcode, and it will get that nutrient label with the source reference for that particular food item. As you can see here, all the nutrient labels would be displayed based upon what I have eaten. So coming to my data, right now I've uploaded the data myself for 2 annual checkups that I have done. In addition to the annual checkups and the other healthcare data that I upload, it's difficult for users to upload their healthcare data by snapping images and uploading it here. In addition to that, there is a functionality to mail your healthcare data to the Nara mail, and it will automatically sync in your profile, or you can request healthcare data based upon your HIPAA rights by selecting the hospital sourced from Google Maps data. And after selecting the hospital, you can mention what data that you require. Nara will send a mail from your personal mail itself. You can send it, and Nara will create that particular draft, and you can send it. And once it's uploaded via a secure link that Nara itself produces, it will be synced here in your profile. In terms of devices, I have connected my Whoop and Apple Health Kit to my profile, so I can see wearable information on my profile. I also have my insurance card uploaded, so if I want to know what I am covered for, I can ask a question here, or I can basically get a stat on what I am covered based upon a summary that is listed here. So these are the various ways in which data can be retrieved. Either you upload or request the clinic to share your healthcare data or of your dependents, and it will be synced to your profile. You can also have a caregiver access. A caregiver access is that if you want to invite a dependent, perhaps your mom and dad, into this application and manage their profile, you can give the mail ID here, and they will receive a mail with this particular app link for them to sign up into this application, and it will then show up under your profile for you to manage their health. In addition to all of this, the Care Navigator allows a user to identify a physician in the US. So if I want to, let's say, find a dentist in Alaska, right? I can just type this in, or I can use the filters on the right, and it'll give me the dentist based upon Google results under best match. But I'll get the list of all the dentists out there based upon the CMS medical healthcare records as well as Google Map records. It also provides me the full profile for these dentists, and using this I can basically check appointments for any of the physicians on this particular page, and it provides certain data that is autofilled by Nara. I can use the autofilled information and copy the information and go into the clinic's appointment page and basically book that particular visit. Going back into the Care Navigator, in addition to booking appointments with the physicians outside US and also within US, if I want to book an appointment with a hospital, I can do so right here. So basically I can type in or basically search a particular state in India, and I'll be able to find hospitals in that particular country all across the world. So here I see so many hospitals down below. This is the limited option, but you can actually put in your state to identify any specific hospital around a specific city, etc. Or you can put it in this particular search box. Similarly, here you have the functionalities to check appointments, to find doctors at this particular healthcare clinic as well. In addition to Care Navigator system to book appointments with physicians and hospitals all across the world, all the appointments that you book would be listed here, and you will get a visit packet which is tailored to that particular appointment. So if I have made an appointment with one particular hospital, it'll show me all the records for myself based upon the data in my data portal, and it'll list my reason for the visit, the key areas of concern, and it'll essentially create a health packet for me to consult with my doctor when I go to the clinic. In addition to that, all the doctors that you have consulted with in the past would be present here, in addition to the hospitals. And there's also a page where you can, if you are interested in signing up for clinical trials, if you are in a late stage disease, you can also find the clinical trials that are being run in one particular space, let's say lung cancer, and then you will get the details from clinicaltrials.gov, and you can be recruited by contacting the concerned person for that particular clinical trial. It also allows you to do some amount of research for any particular disease area or a product by searching for that particular term in this particular query text box, or of any abstracts presented at conferences. So all of these are various modes of how to use Nara, your health command center. In terms of UX, there are a few UX systems as well that you can play around with. If you want another mode, you can switch to night mode and basically completely utilize the application in the form of that. So this was a quick overview of how you can use Nara. I use it daily to track my health record and of my parents. I hope you can use the same thing and derive a lot of insights from your health data.